Welcome back to another episode of the Huxley Morton podcast, the show where each week we speak to pharma company owners and industry leaders sharing their stories of personal and professional growth. This week, I am joined by a duo. We have Edward Olano and Murph McKeon from ArrowDX. I'm also joined by my regular co-host, Mr. Adam Walker. Happy New Year to you, Adam.
Good to see you, James.
Welcome to the show.
Happy New Year.
Perfect. Well, look, Edward and Murph, look, I've given you a very brief introduction and highlighted the company name there. But look, it would be great to kick us off with, I guess, a little bit of an introduction in your own words as to who you both are, what ArrowDX is all about, and give us a quick insight as to what you guys are doing and trying to achieve.
Great. Hey, thanks, James, for the opportunity. Thanks, Adam. So I'm Edward. I am the co-founder and CEO of Arrow Diagnostics. I grew up in San Diego, California, did my undergraduate at University of California at San Diego, then did graduate work in physical chemistry at University of Texas, Austin, Texas. And after UT Austin, I worked in several industries. I worked in the research industry, did some work at Lawrence Livermore Lab in chemistry. And then most recently, I worked at UCLA as a program manager for computational biology for almost a decade, 9.5 years. So while I was in grad school, I had the itching to get an MBA, which I never did. But I took a few business classes, and it was something that I wanted to do when I was younger, and I didn't do it. And then I ran into some friends from graduate school back when I was living in LA, and we decided to do it. Right, over coffee and a couple of beers about 3.5 years ago, decided let's just do it. Had no idea what I got myself into. And fast forward 4 years later, we have a company. It was very hard to start, and I had some good mentors along the way, and also worked with the American Chemical Society to get my company off the ground. But that's briefly who I am.
But look, it's amazing what can be dreamt up over a few beers and how that can escalate at times. I think certainly some of my beer escapades have not necessarily always resulted in me starting a company in the sense that you have, probably less productive than that, should I say. But we'll jump into what you're doing at ArrowDX in a bit more detail shortly. But Murph, what's your involvement with the company as well, if you can give us a quick overview?
Yeah, sure. So I've been in the life science industry for 20 plus years, all on the finance side. Spent a good deal of time at large public company, running their finance operation for one of the business units. I decided to take my career and sort of flip it on its head and start working with small startup companies, early stage companies, to help them build out the finance and accounting organizations. I met Edward about a year ago at a networking event here in Boston. Got interested in his technology and sort of the wide range and sort of broad use of the platform. And same thing, we had a couple of cups of coffee to learn more about each other and sort of the product and the market. And at the end of the day, what I like to do is, albeit it's on the finance side, but I like to deliver products that help improve patients' lives and give them a better quality of life. So Edward had a pretty good technology. It looks like we'll be able to help some folks along the way. And over the past year, we've been trying to raise some money for the company. So fantastic stuff.
Well, we'll get into the platform and all the data and side of things, and I'm sure that Adam can pitch in on that area, because that is his area of expertise as a biometrics sort of subject matter expert. But look, when I first came across the company, I saw revolutionizing diagnostics through AI and nanotechnology to enhance detection. Now, I guess to an everyday person, that may not mean too much, but give us, I guess, what's going on behind the scenes there? What's the vision for the business? What is it you are looking to achieve on a daily basis? I guess because anyone running a business is normally so headstrong on what they're looking to achieve. It's so busy, so it'd be interesting to understand what your day-to-day lives look like and what's going on with the business.
Great, great. Well, James, we are a startup company. So in a nutshell, what we do is we enhance detection for a variety of applications. You know, I firmly believe, and so does the rest of my team, that there has to be inexpensive diagnostics, inexpensive way of testing for diseases, for pollution in water. You know, this pandemic has shown us, especially right now with this Omicron variant, that testing is extremely important. It has to be accessible, accurate, and inexpensive, you know. And so what we want to do is we want to deliver that type of diagnostics to any part of the world. That's our long-term goal. And it delivered in a very inexpensive fashion and something that's accurate. Now, we don't want to replace other diagnostic tests. We want to complement them, right? So that a physician, a patient can say, hey, I tested myself along these 3 platforms and the results are identical, right? And so our day-to-day right now is we're trying to close funding round. You know, we're based out of the Boston area, working with mentors, accelerators, and hoping to close that round before the end of February. Most recently, to our company's scientific advisory board, we added Dr. Sanjeev Chopra. He's a doctor at Harvard Medical School, a world-renowned physician, has joined our team. He has an expertise in NAFLD and NASH. So right now, it's a fundraising marathon, as to say, trying to close the round, trying to get established in a new lab in the Boston area. We're looking to get established in Lowell, Massachusetts, just outside of Boston, and hopefully trying to recruit a few more interns to the company and get more work done, right? But right now it's a funding raise, trying to get the attention out there, people to know what we're about and what our final vision is, right? Inexpensive diagnostics.
Cool, and the focus, as you mentioned there, is NAFLD and NASH in terms of what you're looking to detect.
Correct. So, you know, when we first started the company, we have a general platform that can pivot to multiple business verticals, whether it's a medical vertical or environmental vertical. And I went through some training at an accelerator by the American Chemical Society, where I met some folks in the Boston area. You know, I grew up in California for the most part. And I met some physicians at Harvard Medical School, Boston Medical Center, and we came across NAFLD and NASH, right? And you know, it's a disease that, number one, is very challenging to detect in the earliest stages, not caused by alcohol consumption. It's basically fat accumulation in your liver, right? And so our goal is to work with those doctors that have challenges every day. Now, we talked to a few clinicians, and they told us that, you know, if a patient has elevated liver enzymes, you know, you get your blood work done. It doesn't tell the doctor that much. Now, maybe you have an issue with your liver, maybe you don't. Usually you do, but usually the recommendation is more blood work, more urine work, or if the patient's overweight or diabetic, get the patient on a diet. The problem is that although that may work initially, say 2 or 3 years down the line, you're no longer early stage. Once your liver gets stiff, you're heading into cirrhosis and some very crazy things like liver cancer, right? So physicians would want a tool that they could help differentiate what patients they need more testing. Now, a liver biopsy is the gold standard, but liver biopsy is invasive. You know, there's a chance that you might get an infection, 5% chance. And also liver biopsy, when they remove part of your liver, it works well if your liver is stiff. Same with the ultrasound, right? I mean, ultrasound is a great 3D image of your liver, but if you're in the earliest stages, it's very hard to tell, right? And once your liver is hard, then definitely you have the disease, but then you're no longer early stage. So the challenge right now is early detection. And also these physicians are working on coming up with biomarkers that indicate that the patient is in the earliest stages. So our job, you know, we're not a biomarker discovery.
Could you give me an overview of what these biomarkers would be? What sort of things are we talking about here?
So these biomarkers would be in your blood. They could be microRNAs, very, very small proteins, things that the physicians have identified through clinical trials in their research that are signatures of the disease, right? And so obviously a liver biopsy is not going to catch that. You want to have an analytical test, a blood chemistry test that could catch that, right? And that's where we come in. We come in with our technology to work with these doctors that have isolated these biomarkers, and we detect them, right? And the ultimate dream, the ultimate goal after going through commercialization, after going through FDA approval, would be to have a tool where my physician can say, Edward, I'm going to run the arrow test on you just to double check that you do or do not have early stage NASH.
Wow.
And so obviously the arrow test would work. And then my physician could say, Edward, I'm sending you to a specialist, right? Because right now doctors are kind of dumbfounded sometimes, because should I send my patient to a specialist? Should I send my patient for a liver biopsy? They want more definitive information to make that decision in the earliest stages.
Amazing.
It sounds like there's a very broad brush that's being applied at the moment, and you're going in for specifics there, Edward. What you've described,
Correct.
there are many routes into identifying NASH by the sounds of it, and as I think, well, as I said to you, before we came onto the pod, I was actually diagnosed with this a couple of years ago, and this was through my GP, and I had some bloods done, and they advised me to just change my diet, and I haven't drunk alcohol for 2 years. So, and I had a very low alcohol intake. So I was that classic person that you're describing. I definitely needed to lose some weight, and there were some lifestyle indicators there. But what's interesting from what you're describing is that there are some specific diagnostics that can be performed relatively cheaply that can give you a very good indicator and hopefully prevent that exacerbation and prolongation of the challenge.
Correct. And so, this is a space that's taking off. I know that COVID is a lot of attention on COVID, but this space is also taking off as well. And physicians, pharmaceutical companies, Intercept Pharmaceuticals, a lot of the pharmaceutical companies around the country, United States, worldwide, are working on therapies for NASH. So at some point in the next year or two, a companion diagnostic or a diagnostic will be needed, right? And so, it's unfortunate that a lot of folks have this disease, but let's try to catch it early. Anything that's caught early works out well, right?
But I think also the other interesting thing for anyone listening to this is that there aren't necessarily any particular early indicators to an individual, are there? They're just lifestyle factors that compound one another and ultimately can create all sorts of complications.
Correct. And also you said it right on the dot, Adam. I mean, if you're diabetic, overweight, hypertension, then that propensity is going to increase significantly, that you're going to advance to the later stages very quickly.
Well, I didn't know that there was so many variables on something like this. And I guess it's kind of drawing me to, where perhaps the company name now came from, because I have in mind kind of where it may have been, but so you guys, it was 2017, wasn't it, that you started, Edward?
Correct. And like I said again,
if we take you back to that time, look, did you always want to go down this route? And where did the idea or the name of the company come from? What was going through your head kind of in those early days when you decided, look, we're going to do this, whether it was over the couple of beers or however it came about? And where did the name come from? I'm very much interested in that.
I had just applied to the American Chemical Society accelerator they had, and met a great person there at the accelerator. And I was watching a TV show at the time weekly. It was a TV show on the network called CW here in the United States, called Arrow. And so to me, Arrow helped me think about the name of the company, because Arrow Diagnostics, we focus on the right target, the target that we want to detect, right? And so for us, it's like, you give us a target, we aim for it, and we take it down, we shoot it for you, we catch it for you, right? And so that vision came through my mind, and I ran it through my legal counsel. I got the company incorporated, all those little details you have to do.
Yeah.
And we started the company, right? But the vision was, I had been watching the show a lot. I saw arrows on the show. I knew that for us, if you're a customer and you say, hey, Edward, I have these biomarkers I want you to detect, we'll aim our arrows and detect them for you.
I thought it would be something along those lines. I was thinking kind of straight as an arrow, pinpointing things, hitting the target, because when talking, just listening to yourself and Adam there, talking about this whole array of where things can come from, just that hitting the target bit was what was standing out for me. So I'm pleased with my guess, and yeah, it's good to know where that came from. And look, what did the business look like back then? Was it yourself and just a couple of partners? Obviously, you've since roped in Murph as your finance guy, etc. Just over a year ago. What did it look like? And now talk me through how things have gone since from 2017 up to where we are. So involving Murph and getting him on board, etc.
So back then we were an idea on paper. So I had applied to an accelerator at the American Chemical Society. We were admitted. I had no idea about incorporation. I didn't know anything about business really.
Wow.
So once I got some of the bolts and paperwork started, I rented lab space at night to get some proof of concept work done. And because I had a day job and a family, it was very, very challenging. It took me a long time to get the work done. I would come home from work at 5 or 6 in the evening, have dinner, and then go to work in the lab till 2 or 3 in the morning.
Wow.
Yeah.
Oh, there was me and Adam thinking this extracurricular activity doing the pod was takes up time, Adam. That's some input, right?
That's commitment.
Yeah.
And actually, labs are the greatest place to be.
I was very lucky to have a family that was understanding for the most part, but it was very challenging, and it took a long, long time. Much longer than had I just done it full time, right? And then once we had some proof of concept data, I met some other folks through the accelerator. I met Robert Bazzelli, who's part of my advisory board. He's based out of Pittsburgh, Pennsylvania. And when we first started the company, we were focused on environmental diagnostics. We were looking at detecting metals in water, and that's still one of our business verticals. And so we started working with people in the Pittsburgh area. So by then I had made up my mind that I wanted to leave San Diego, and I did leave San Diego eventually to move to the East Coast. And so we were pitching to partners in Pittsburgh, Pennsylvania. And while we were pitching to partners in Pittsburgh, Pennsylvania, we noticed some things. The water space is a great space to be in, but we kept getting the feedback that we had to look at biomedical applications, right? That's where we could get more traction, more investors, more partners. And so I went back to the drawing board again. I told my partners and my folks, and I said, you know what, I'm gonna have to go back into the lab and try to get some work done. So I had some great scientific advisors at the time, and I went back into the lab and started to work to detect proteins and enzymes. So once again, I would do this outside of work, and we got some more data, and then we went back to start pitching to folks. And by now we're looking at 2019, right? So this is taking much longer because I had a full-time job, and I was doing this just on the side. It's very challenging to leave your job when you have a family, right? And so we're ready to start pitching. We got a lot of attention. We're working with the M2D2 accelerator in Lowell, Massachusetts. Dr. David Cohen from Harvard Medical School joined my scientific advisory board, and then I recruited Murph, and we had a lot of traction. And then something came out of the blue that hit us, COVID-19. Everything came to a halt, back in March 2020. I had like 6 meetings lined up at the end of March. 5 of them were canceled.
Wow.
Right. So I'd say that the first 6 months of COVID, everything just came to a halt. Until people got used to Zoom and those type of meetings, it took a while for it to get started again. The last few months have been great in the sense that things are picking up very quickly again. And right now we're trying to close that round of money. We have some interested investors on board, but they're looking for matches to their funds. We're trying to close the money in the next 30 days to get back into the lab, in our new lab in Lowell. And that's pretty much, I summarized everything. I'd say COVID-19, slowed us down significantly.
Yeah.
Yeah.
Just, I mean, before we come on to the COVID bit and kind of bringing Murph on, etc., I'm just thinking back to this extra curricular activity that you were doing and kind of moonlighting with, you know, on in addition to your day job, which sounds like you were putting in a massive input. And I've often, you know, got friends who sometimes want to, you know, try doing what we do as a business and recruiting. And, you know, I offer them, they want to do a bit of freelance work and it would be outside of their regular hours. But very few people can actually do that because, you know, just daily life and daily grind is just tough enough, right? So I'm just thinking, what is it, Edward, that has kind of given you that level of, not necessarily just motivation, but level of persistence to actually go out and do that? Because there's so few. Normally when we speak to other entrepreneurs on the show, Adam, it's a case of they've decided that the day job isn't for them and they've just kicked it and then gone all in, whereas this is a completely different story, isn't it, where you've said, look, I want to do it, but actually I still value the family life and I can't give up on that. So you know what, I'm actually going to do both. So yeah, what is it, I guess, inside you that allows you to push that? Because there's so few people that could perhaps do it.
So first off, I enjoy science. Many times I wish I could go back to being a student again. You know, there was something about taking classes and learning new things for the first time. And even, you know, I remember taking courses where I wouldn't do well on the test. Yeah, that was disappointing. But once I figured out how to solve those problems, it was like a rush, an adrenaline rush, right? So number one, I enjoy what I do. I always have, always will to the day I die. Number two, I'm the type of person that once I start a project, I'll see it through to the end, succeed or fail, right? I don't like leaving projects undone because someday when I'm 90 years old and, you know, getting ready to, leave, I want to leave with no regrets, right? You know, I did it. It didn't work out. It worked out, but at least I did it, right? So, if you were to ask my parents, they said, yeah, Edward's always been that way. You know, when I played soccer, maybe at the beginning I wasn't the best player, but you know, I hung in there, right? And, you know, a year later, I was one of the best players on the team, right? Because I put in the time, right?
Do you think that any of this has come from your, I guess, your upbringing, your parents, or was there any particular mentors or people that you looked up to back then that kind of gave you this drive and determination? Because, you know, I think in many ways I'm a little bit similar. If I do something, I want to do it well, whether it was, you know, soccer, whether it was boxing, whatever it always was. It was typically sports for me. Sometimes I sucked at them, but then that would grate on me so much that I'd have to practice, and, you know, because I wanted to be the best at everything, and I would just go away and do the work for it. And I don't really know where that came for me. But is there anyone that you kind of looked up to at the time that kind of pulled you through and gave you that mentality?
Well, I think it's different. There's several factors. One is my upbringing. You know, my parents immigrated from Peru to San Diego in the late 70s. You know, we lived the American dream, so to speak, right? Upper middle class in the suburbs of San Diego. They worked 2 or 3 jobs at the very beginning. And, you know, second is when I wanted to become an entrepreneur after taking those business classes, I talked to a few people that had started companies, not necessarily bio companies, and they told me, "Hey, Edward, it's a lot of work, man." There's one individual that I remember. I don't remember his name now because he was a guest lecturer. He had pitched to over 500 investors until he finally got one that would run the first check.
Holy shit! Yeah, that's a lot.
Yeah, and then I met a mentor 4 years ago, Robert Bazzelli from Pittsburgh, Pennsylvania. Bob Bazzelli. You know, he has a background in banking, BNY Mellon, all those things. But Bob was a great guy in the sense that, you know, he was my mentor. He'd say he was like a coach, right? And he's still my coach. You know, he'll tell me when I do things wrong. He'll tell me when I do things right, and then he'll give me advice and say, "Come on, man, you can still do it. Don't give up on me." Right? It's almost like there's that movie. I can't remember the name, but it's a football movie with some high school kids, and the player has to carry a player on his back across the field.
I've seen that one. There's a lot of clips on YouTube of it, of the
Yeah,
highlight of that.
yeah. So Bob to me has been that type of coach where I'll be honest with you, there've been some days when I'm like, am I doing the right thing? But I have mentors. Murph, my newest mentor, he's also very positive. Murph understands that it's tough. This is not an easy journey to be on. And if I were to tell my younger self, I'd say patience is definitely needed. I wasn't very patient as a teenager or as a college student, but now that I'm older, I'm much more patient. So
on that, I guess, look, Murph, it was just over a year ago that Edward has roped you in for the ride on this one. Look, what were you doing at the time? How did you meet? Because I guess that would have been fairly, high COVID levels at the time. So how did you two meet? I know, look, me and Adam, we met via Zoom. I actually reached out to him on LinkedIn, and he was one of my first ever guests on the show. And now I've met him and his wife in person, and we host the show together every single week. But how did it come about that you two managed to hook up for business?
Yeah, it was, for me, I was in an interesting spot with my career. Like I mentioned, I started working with startup companies, and I sort of lived the life of two companies. One, I helped raise, quite a bit of funding, and unfortunately, we got to a point where no was an option with the technology, and I had to unwind the company. The other company was in the breast cancer space, and we were able to get through the FDA approval process, get some traction in the market, and sold the company to Hologic. So it was sort of coming off of those two consulting, assignments that I had. I sort of met Edward at the tail end of it, just after we had the sale to Hologic. So again, looking for another, sort of fun and wild ride with the startup companies. And Edward seemed to be in that sort of sweet spot of, he had some data and some, bit of technology in place, but needed that next round of funding to really take it to the next level. And that's sort of what I've been doing for the last, 4 or 5 years. So, like I said, I liked his technology. The Raman technology has been around for a while. People, understand it. So it's not like you have to, have that as the proving ground. I think it's really convincing them that, finding the biomarkers and being as accurate as possible is the challenge. And I think, the way he's approached it is feasible. So for me, it was another opportunity to, again, get into a company that's early on and go through the fundraising process. And like Edward said to his younger self, you need patience. You have to knock on a lot of doors, have a thick skin. No is an answer you're going to hear often, and that's okay. That's part of the journey. You want to make sure you find the right partners, and that's what I've been trying to do for the past year. Is not just take any sort of check, but make sure it's the right opportunity for Arrow.
Cool. And look, with that, Edward's already covered that COVID certainly has slowed things down. But how are things looking now? With the trying to secure funding, etc. Staff numbers. Are you back to offices? How many of you are there now? Paint a picture of kind of how things look at Arrow DX sort of as it stands today.
Well, things are much better than they were 6 months ago. We're still working virtually. I started flying just recently. I hadn't been on a plane for almost 2 years. I was on a plane just over the break. So right now, I'd say that we're close to closing that round, and I'm making a pitch to anybody out there that's an investor that would love to hear more about our story, more about our company. They're welcome to contact me. But the goal is to close the round. We've also applied to a few competitions, so everything looks very positive. But all our efforts are closing the funding and getting more work done. I think I'm positive that 2022 is going to be a very good year for us. We have great partners. I just told you Dr. Sanjeev Chopra joined our advisory board about a month ago. So we've got some great folks from Harvard, great folks from Boston, great folks from Pittsburgh. We just need to get that final round of closing for the funding. soon.
Yeah.
Are you
Yes.
finding the challenges that there are many companies, similar companies, not necessarily doing the same thing that you are, but there are many companies right now in and around life sciences that are seeking funding because, of course, over the last 18 months, 2 years, we've seen enormous investment into this field. And every time you open a newspaper, you go online, there's a new startup company, there's a new
Sure.
biotech. I'm just curious, what's
So
been your experience?
We're noticing a lot of funding out there, but it's going to the therapeutic side. We're on a diagnostic side, so it's a little bit different. Right, Murph? Maybe you can add a little bit to that.
Yeah, it's sort of that sort of spin. The same, my previous life, I was in the medical device space. The pharma, biotech, therapeutic, there's a tremendous amount of money out there for diagnostic medical device. It's not quite as rich, still a lot of money out there, but it seems like you need to bang on a few more doors on those two segments versus sort of the therapeutic side. Having said that, we explored all types of opportunities, both dilutive and non-dilutive, looking at grants and accelerated money, crowdfunding, angel funds, individual net wealth folks. So I think, like Edward said, the last few months has been pretty positive for us. We have a few folks that are interested. I think what we find is when people understand the science, they get it.
Yeah.
If they don't understand the science, especially if you're going after some high net wealth individuals, like if they don't have a science background, it's kind of hard for them to truly understand and say, okay, that's where I want to put my money. But I think recently we found the right partners who understand what the Raman technology is and what we're trying to go after. So,
and dare I also ask, COVID must have overlaid another filter on that as well with respect to everyone's in COVID right now. I mean, is everyone looking for a COVID diagnostic treatment as opposed to anything else, or looking to invest into COVID as being the next big thing or the now?
Mm-hmm. Yeah, I mean, we've definitely had questions about whether we could pivot the technology to take a look at COVID.
That was my question.
And it's one thing that we can do for sure. It's one of those things as a startup company, you can't be everything to everyone. So, how much can you really pivot and not distract yourself? We did explore it a little bit. Even the town I live in, Westford, Massachusetts, they agreed to be a donor of wastewater from some of the complexes here for us to use if we wanted to test for COVID or not. So I think there's opportunities for us to do it. It's just whether will that, really dilute our daily focus on trying to focus on that first goal of NAFLD and NASH.
It sometimes, as we've discussed many times, James, sometimes it's about knowing what your focus is, and it's knowing what your focus isn't it?
Right.
And back to your name, the laser focus and the arrow should be on what you're aiming for rather than what you're not, because the broader you go, the less focus you have around where you're directing yourself.
Right.
It's what we see and hear all the time, isn't it, James?
I think so. And I, you know me, Adam, I'm a massive fan of just sticking to your guns. So I'm almost pleased, Edward and Murph, that you didn't say, oh yes, we're going to be doing this and we're going to be going after COVID diagnostics, etc. I'm glad that you were like, well, we could do, but actually we kind of know what we're good at, because that's what I believe is one of the keys to success in business is sticking to where your core competence is. So look, I'm pleased to hear that. And look, give us a quick overview of your plans for the future in this space, and plans for both of you, both individually and ArrowDX, as we head on into 2022. What are you envisioning? Is there any predictions that you've got for the market in general, for you as a business? If you can give us an insight into that, that would be amazing.
Sure. So, as Murph was saying, we're confident we're going to be closing this round shortly. The goal is to complete the validation with the biomarkers from our collaborators at Harvard and BMC, and then start going through the regulatory process that we need to go to. That'll probably carry us through the rest of 2022. We have some grant funding that's pending. accelerator funding. So yeah, it's going to be a busy year of R&D work. The fundraising never stops. And also the marketing. Well, having people be more aware of what we do. We have a lot of verticals to this applicate to our technology. And so maybe at the end of 22, after we've done more work on NAFLD and NASH, we may start looking at another vertical. And the vertical that comes to mind is what people have asked us to do, to look at viruses and bacteria. But the rest of the year is R&D work, fundraising, marketing, and regulatory application.
Yeah, it's really sort of getting through that final product. What is Arrow truly going to deliver? And then, sort of increase the awareness of both Arrow as well as for NAFLD and NASH. Hopefully we get to go to a couple conferences this year that can be in person rather than the virtual ones. And I think, just having those face-to-face conversations, it's just a lot easier to get your message out there. So, fingers crossed.
At this point, that feels like pressing the flesh would be the most viable avenue to seeking that funding, wouldn't it, by the sounds of it?
Yeah. I think sitting across the table and having that live conversation with someone, and you sort of see the body language and how excited they are. I think that comes across, a lot better, live than via virtual.
Cool. Well, I know that I'll be interested to see how that all pans out for you both. I'll be keeping in touch, I guess personally, and probably having other discussions down the line as you hopefully are continuing to grow. But look, I guess before we let you go, of course, we will hook you up with links to yourselves for any investors and anyone that wants to reach out with further questions, etc. On the show. But look, before we let you go, we always finish up the pod with a quick fire round of questions for you both. So I don't know whether you want to pitch in with an answer each, or whether we flip one to Edward, one to Murph. But look, I'll kick us off, and I'll direct it to you, Murph, because I guess Edward has already touched on this a little bit. But look, what is the number one piece of advice that you would give to your younger self? Edward talked about having patience. What is the advice that you would give to your younger self?
It would be, don't be afraid to fail. All right, if you first don't succeed, get back on the horse and try it again.
Well, it sounds as though you've taken that and you're used to that now with your motto of, look, you're going to get a lot of no's, you've got to keep going. So look, that's proving in good stead right now, isn't it, Murph? So
it is
solid advice to your younger self, I think.
But I also think, failure is where you learn, isn't it? You learn from your failures, you pick yourself up, you question to yourself what you've done and what you would do differently the next time. And, if you've never failed, then you never succeeded. Yeah, some of my biggest failures have been the transformative ones that have actually directed my decisions at a later point through personal and professional settings. So, yeah, I think that's a great answer, Murph, actually.
Definitely.
So if I direct this one then to you, Edward, if you don't mind. So our listeners like to hear what books are on your bedside table, what are you listening to on podcasts? Where do you get your inspiration from?
Let's see, there's a book that I read back in high school that I look at from time to time, The Call of the Wild by Jack London. It's an old book, but Buck the dog, where he was like a half dog, half hybrid dog. He had to learn to survive. He had a pampered life at the beginning, and then he got thrown into some traffickers and ended up living in Alaska, and he became wild. They learned how to survive. So I think it's survival, right? So it's always being practical, and things that I've learned through that book. A movie that I watch from time to time is Pursuit of Happiness with Will Smith.
I love that.
It's a great movie, right? So those are the two.
Fabulous film.
I'm not. Everyone says that. I'm not a fan, I find it
came up on Netflix on my recommendations the other day.
I find it almost too frustrating. I'm just like, how many bad things can happen to this one guy? It gets me, and then you get a couple of minutes of happiness right at the end.
He's got resilience. I think the lesson is resilience, isn't it? It's pick yourself up. It's go and go again.
Correct. And then and that's pretty much. And then in terms of podcasts and stuff like that, I scan the news every morning. I scan several networks. I'm not going to say which ones. and then I come up with my own conclusion as to what's really happening in the world today.
Good
That's great
method.
advice.
Cool. Well, I'll move us on to the next question. I'll throw this out to both of you, because you're now kind of in business together. You're going to be hopefully securing that funding and growing teams in the not too distant future. So look, what are the top 3 qualities that you both value most when building a team, a business, etc.?
I guess the first one is resilience, honesty, and passion.
Okay, I like it. Murph, let's hear from you on that one as well, because I always like these ones. I'm a recruiter at the end of the day, aren't I? I can't help it.
For me, given finance, integrity is the biggest thing, right? You're going to be responsible for this money, so you want folks that come in that you can trust. And I think especially with startups, yes, people are looking at the technology, but they really look at the management team. Do we trust the folks across the table with our money? So integrity would be one. I would say sort of conviction or commitment. You have to be convicted in the product that, this is going to help, improve a patient's life and make life better for them. And I think, that will drive you going forward. And I think the other one is probably like Edward said, just resilience, right? We want folks that, a door's going to get shut in our face. That's okay. Let's learn from it. Let's pick ourselves up and move on. So
that's the life of startups, isn't it? You've got to have that thick skin, because you're going to get disappointed, and it's going to happen a lot.
Right. Got to learn to smile regardless.
Absolutely. So Edward, you made reference earlier to enjoying what you would call soccer, what I would call football. Is that your passion along with your family outside of work? Is that what you look to enjoy?
Yeah, definitely soccer and American football. The only problem is now that I'm older, if I fall down and have an injury, it's actually traumatic now.
Takes about 3 weeks to recover.
Or I end up in ER like I did 4 years ago. I jumped for the ball, and I don't think I broke anything, but I couldn't move, and so people got scared and we ended up in ER. I had a sprain.
And you, Murph, what's your favorite things outside of working?
I love being outside. Right now I have 3 young boys, so I'm heavily involved with their sports and their activities. I love coaching. Lacrosse has been sort of the common theme for my 3 boys. So I wish I had lacrosse growing up. I grew up part of a country where it didn't exist, but it's an awesome sport, and I'm just glad to be able to be out there and playing with them and learning about it and enjoying the ride. So.
An active bunch that we got on today, Adam, isn't it?
Very good.
Sports. Love that.
Absolutely. Well, you're amongst people with active interests ourselves. So yeah, definitely. I'm sat in my garden in the fresh air when the doors are open. So as is James.
Yes, indeed. Not with the doors open, because it's just been raining and it's freezing outside where I am. But look, to finish us off, gents, look, finally, if you could let me know your #1 golden rule for life and in business in general. So a bit of a deep one here, but if you can try and narrow it down to your #1 golden rule. So Ed, we'll start with yourself.
#1 golden rule is to believe in myself. As Murph said, sometimes things don't work out the way you think you wanted it to work out. And when one door closes, another door will open. Sometimes things happen for a reason. Many times I thought that I had failed, and yes, I did fail on something, but that led me to a success, right? Destiny sometimes has a strange way of letting you know that you're on the right path.
Cool, I like it. And Murph, yourself?
I think the golden rule is to have fun. You have to enjoy what you're doing. You can't do something for a paycheck. That paycheck gets stale pretty quickly. And I think if you're enjoying and having fun what you're doing, I think those other qualities I mentioned before, the resiliency and the passion and commitment will come from there.
And actually, That's a brilliant point, but also I think it attracts like-minded people. This is what James and I find all the time when we're talking to various people on the pod. Is exactly that point. You put out what you get back, and you attract similarly incentivized and innovative and challenging individuals that want to come along for the ride, don't you? This is clearly why you two have connected as well.
Mm-hmm. Yep.
And I think that's particularly unique to hear as well, Murph. And I like to hear it from a finance guy, right? That's coming from a finance guy who's saying, you know what, actually, one of the keys and golden rules in life and in business is to have fun. So look, I think that just debunks a lot of stereotypes around finance people at times. So look, Murph, you've given a great insight there. And gents, it's been fantastic to have you on the show. As I say, look, we'll get you linked up for anyone that wants to reach out to you. In terms of that, what's the best platforms to reach you? Where are you most active? Is it your website? Is it LinkedIn? How should any of our listeners who want to hear more, investors, what's the best way to get
the best way is via my personal email and via LinkedIn. I think LinkedIn is probably the easiest way. Anybody that messages us via LinkedIn, we'll usually respond within 24 hours.
Fantastic stuff. Well, look, gents, thanks once again for being a part of the Huxley Morton. I'll let you both get off to enjoy your day, but been an absolute pleasure. Thank you.
Thank you, James. Thank you, Adam.
Thanks.
Nice to meet everyone. Take care, guys.
Thank you.